And I think we can all agree on that. Like, that's not what we want to do. The unfortunate byproduct of that was that when it came time to involuntarily treat people, like someone who was gravely disabled or they are suicidal, danger to themselves or others, we were not allowed to use force to take them to the next level of care. Now, I'm not saying we need to beat people up or we're beating people up, like, let me beat you up to get you care. But sometimes we have to put our hands on people because they don't want to go, they want to kill themselves. And sometimes we have to physically intervene and put handcuffs on them to take them to the next level of care so they don't kill themselves or others. That was taken off of our ability to do. The legislator made it clear, don't intervene with that. So that got corrected. The legislator, after a couple of years, saw the error in the way and made some changes. So now that can happen. But it has left kind of a residual effect with some officers, some people in our profession of, you're really going to take an extra time to think about what are the possible things that could happen in this interaction should I need to use force on somebody who has not committed a crime.
Which isn't necessarily a bad thing. When you talk about like the governmental interests, it creates a pause, as we've learned from experience, to go, so this person is a danger to themselves. What's the potential that they're a danger to others? And what's the potential fallout to them hurting themselves or others? And what's the likelihood that they'll hurt others? And so we use a term like time, distance, and cover. And so if we take a pause and consider this individual, let's just say, who's alone in their home, who's called in to say they're suicidal, and we know they're all by themselves with no plans or and no belief that they're going to leave their home, it gives the police officer pause to go, because in the old days we would have rushed to their house to help them.
Yeah.
And I'm not being critical of that, but we are wise to learn from experience and go, okay, let's take a minute to consider the governmental interest in this individual who's only a threat to themselves. And we want to help them if we can. But we also have to consider what could happen if we go and how that could escalate. And so there's a benefit to taking a second and a tactical pause to consider tactics. And so now compare that to an individual who's calling in, he's sitting on a park bench downtown in a congested area, or people are calling about an individual who's threatening suicide, who's out in the public. We have to handle that a little bit differently. And so it's just, over the decades, we've learned from bad situations, or where things didn't go well. And so continue.
Yeah, I bring that type of situation up just to show how beneficial it has been to have people that are in the mental health field help me do my job.
Yeah.
But the symbiotic relationship, whereas I get to help them do their job in the same facet. So some of the folks that work for us have worked in organizations where the cops brought the person handcuffed, shackled, and dropped him off there and said, here you go, fix him. And now they get to see, oh, wait, there is some things on the back end, on the police side, on the street side that happened that, they weren't quite aware of had happened. So it is a great relationship, because then I get the benefit of be front loaded with knowledge, or have a greater amount of knowledge with my behavioral health person to say, hey, here are all the gaps that you may not be aware of with either this person's condition or people that experience this condition. It helps have me be more articulate in my response. My position also affords me a greater amount of time because I'm not responding to calls for service on the radio. Whereas before, there's always a competition when you have a patrol officer or supervisor. They're always listening to the radio and have to anticipate the next call for service that may come out. Maybe something critical. It may be, as a supervisor, you have 4 or 5 other folks that are working for you. You need to pay attention to all the calls they're on, plus whatever a behavioral health person is presenting you, which is not a crime, which as you're prioritizing is probably going to go to the bottom. So all that has afforded me more time to do my job, which has saved lives. For instance, I responded with one of the state DCRs, not one of our folks, a mental health person in the community that called up for assistance. They needed to go talk to a person that was known to be a severe alcoholic, and apparently they were having an episode. It was someone I did not know, the DCR nor the person that the house we were going to. I get there and I speak with the DCR. We brief about why we're there. It seems like a kind of a bread and butter call for a patrol person, where a patrol person probably would have heard, if I was on patrol, if I would have heard what was facing me, I probably would have went, why am I here? I got to go. There's crimes happening. I was afforded the opportunity, because I had time on my schedule, go in with them, spent probably the better part of 45 minutes or an hour in this person's home, gathering information from a loved one and interacting with a person who I thought at the time was kind of playing possum and not reacting normally, just saying, okay, this person is intoxicated and they just don't want the cops there. They don't want to talk to the DCR. Tried each of us trying to interact, just wasn't working. It was in that extra time, because I remember there was a point where I was like, I'm leaving. This is nothing. I'm leaving. But I thought, I have time to spend. Let's spend the time. Ended up trying to get the person, telling me, you got to go with me. We're on the path now of involuntary. You're not going to be able to make the choice because of what was presented to me. And person, again, we go to try to get them to go, and they're just limp and not going to go with the program. I'm like, okay, I'll order up an ambulance. I get an ambulance, shows up, ambulance crew gets there, they're doing their thing, and all of a sudden there's a flurry of activity, and we got to go now. I'm like, oh, okay, let's get going. The person's blood sugar, I think, was in the 20s, which is critically low. Mm-hmm. And I was like, oh my gosh, yeah, I'm glad, let's get them going. We get to the hospital, and I do my paperwork at the hospital. This is why we're here. Off I go. I end up back at the hospital later, and the nurses staff are like, hey, you the one that brought in so-and-so. And I'm thinking, oh my gosh, what? Now what? It's always good when someone's like, are you the one who brought so-and-so in? But they say, you saved her life. Like, it wasn't just me, it was everybody in the process. But when they got to the hospital, the blood sugar was in the teens. And if we would have just written it off and went, you're drunk, sleep it off, probably would have went into a coma. And if the loved one wasn't there, we could what if this forever. But that could not have continued for another 12 hours.
Yeah. And your ability to handle that call with what gave you the time was you're specifically assigned to the behavioral health unit. You're not a slave to the radio. You're not responding to calls for service like a patrol officer. And by no fault of their own, the patrol officer is having to triage emergencies and calls for service quickly so they can be available for the next call for service. And so not always time to dedicate to that. But in your unique position with the behavioral health unit, you're able to, your schedule is more free. Yeah. That's your whole job.
It's my whole job every day.
Yeah. And so in the last stretch of time we have here, you now have 5 crisis responders working with you on a schedule of, they work Monday through Friday, correct?
Yes.
And you have the community outreach or the community outreach coordinator and yourself. What then, you now work at our satellite station, and outside of the main station, you work down at our satellite station. You have your whole staff there some days of the week. Just give us a picture of what your average day looks like, or what their average day looks like.
So I start my day with the community outreach coordinator, and we go out and beat the brush to find where people might be either illegally camping or trespassing, to educate them and to encourage them, and then to enforce the law when it comes to it.
Pre-dawn every morning.
Pre-dawn every morning. Mm-hmm. Every work morning.
Right.
Then that takes us probably a few hours, depending on the day. We come across people in various states of where they're at in life. If we come across somebody that we feel like we can help with the problem, then we start problem solving. And that could mean getting them to the next best service, or connect with a behavioral health unit person to get them to them offloaded for some intense short-term case management to the next best location. That has proved to be very successful. We've had many over the gosh, what is it, 9-10 months now, many interactions that have had some great impacts. One time we came across a guy that was camping in our park. He had a tent fully set up in a city park in the center of town, which is completely forbidden. Camping is always illegal in our parks, and this is something that I hadn't seen for years, a full-on tent set up in a city park. It happened to be the city manager that brought it to light to me early in the morning. So I get a message early to my terminal that there's a tent set up. And I had like straight there from, I have a route that I do, and I broke the route. I'm going straight. What is going on? Why is there a tent set up? And I'm getting my computer fired up. Like there's handcuffs getting put on somebody and a ticket's getting written. Like someone's going to jail today. Who has the audacity at this point? Because I feel like I've educated everybody that I've come across. Mm-hmm. And so I get there and knock, knock, knock on the tent, shake the tent, nothing. I hear a guy mumbling inside, rustling around. I'm like, this guy's not even talking to me. I'm like, hello, police department. And I feel like I'm yelling and nothing. I'm shaking the tent violently. All of a sudden I hear, who's that? What's happening? And I'm like, it's the police. And I get nothing back. And the tent opens up. A face pops out that I haven't seen before. And it became readily apparent that this person is very hard of hearing due to the level of conversation they're having back at me and what they're not picking up. I could see they're trying to read my lips as I'm talking to them. Like, oh my gosh, who are you and how did you get here? So we go to the old pen and paper, and I find out that he had just become homeless the day or two prior. An organization gave him a tent and pointed him in a westerly direction and said, go camp over there. And I don't know if he got the full information, because I can't imagine someone said to go camp where he was camping, but he went west and there he was camping. At the time, outreach coordinator is now catching up to me on this loop. And I'm like, hey, here's this guy. We need a problem solved here. So outreach coordinator calls up somebody. Hey, we got this person camping. And by the time I was leaving, after they had the camp set up, we were driving them off a couple blocks to the next resource center. Off they were, housed and back living to their life the best they could. Took a couple hours.
So that really illustrates like how far we've come since, say, 2015, let's just say the last 10 years, because while politics are politics and not everyone doesn't agree on everything, the city really does feel like it's working towards a common goal now, both sides of the aisle. Everybody kind of agrees we have to do something, and the model we're using seems to speak to all audiences. The audience demanding compassion, which is appropriate, the audience demanding enforcement, which is appropriate, and the audience demanding education and resources. Like, all of those can't work in a silo. They have to work together. And so over the last decade, we've learned how to piece those all together. We have the support of local government and the resources available to, and the support of the community to problem solve in this multifaceted way. And we've really come a long way with the learning lessons and with the support of local government and of course the chief in our department, like everybody coming together to go, we're going to solve this problem with boots on the ground. And again, not everybody agrees on every element of it, but we all seem to be working towards a common goal.